In this podcast, we'll learn about the myths, facts about the parenting technique. We are back with another podcast. Today we have our special guest, Dr. Ravi Sahota, sir. We welcome you, sir. Sir, can you please tell me about your journey?
Thank you, Dilsher. So basically, we are from a farming background, and my father used to own a lot of land in Jaspur area. And when I was in class second, one day he just asked me, "What are my future goals and aspirations?" And I just uttered simply that I wanted to become a doctor. And from that day, uh, that was the only goal in my life. Though I was never aware of what kind of studies I needed to go through, what kind of preparations I needed to go through. But from class second onwards, I had this one aim in my life to become a doctor.
Sir, as I am bio student, my goal is also to become a doctor. How can I become a doctor?
See, you have to obviously have um, physics, chemistry, bio as your subjects, and
Yes,
then
sir.
after to class 12th, you have to clear this NEET exam. So NEET is basically National Eligibility Cum Entrance Exam. You have
Yes,
to
sir.
have a minimum score in that, and then you'll be allowed certain colleges according to your rank, and then you can choose amongst them.
Okay. So, sir, my next question is NEET is really a scam or a preparation?
Yeah, of course, because last year a lot of things they were surfaced on the media because
Yes.
of some cheating cases were reported. No, NEET is actually important to clear because you have to if you have to enter the MBBS courses.
Yes.
Uh, there were some reports of some cheating cases, but it is not actually true. Government has got a lot of insurances, and there's a separate entity which is taking care of the fairity and sincerity of the entrance exam. So it is a fair exam. It's not a scam.
Okay. So, there is a myth that massage keeps the child healthy. Is it true?
Yes, it is true. See, whenever a baby is born, we always allow the mothers and the grandparents, including the father,
Yes, sir.
to give massage to the baby. And usually, whenever we give massage to the baby, we always ask that it should be given before the feed.
Okay, sir.
Usually, when a mother is or a parent is giving massage to the baby, you are actually touching the baby. With
Yes,
the
sir.
touch, the bonding happens, good hormones, dopamine surge, it happens. The level of certain enzymes, certain hormones, it peaks. Melatonin hormone is secreted, so the baby
Yes, sir.
sleeps better. If there are any body aches in the body of the child, the massage will help to bring those pains down and gives a good sleep to the baby. And bonding causes increase in breastfeeding instances also. So the success of breastfeeding because of the massage is actually reported.
Okay. So, which is the most important vaccine we should give to the baby?
See, all vaccines are important. Vaccines are basically insurance,
Okay, sir.
and their prices are such. If, for example, if a vaccine is costing you around 1,000 rupees,
Yes, sir.
it is actually preventing your child from a disease which may cost you around 20,000.
Yes, sir.
If the baby suffers uh, from that particular disease. See, there's something called DALY, disease
Yes, sir.
associated life year. For example, common cold. So if there are 6 to 8 instances of common cold in 1 year,
Yes, sir.
you go to the hospital, you pay the doctor's fees, say it is 300 rupees.
Yes, sir.
You pay for the test, say 200 rupees, 500 rupees. You pay for the medicine, that may be somewhere between 300 to 400 rupees. So it is around 800 rupees. The parent loses the job that day.
Yes, sir.
There is a transport cost. And God forbid, if the baby gets admitted, the amount of the bill in the hospital may vary somewhere between 10,000 to 20,000. So giving a vaccine against a certain disease is always profitable, and we have to understand that.
Okay. So many people believe that the treatment in private hospitals is very costly.
Again, see, whenever you are looking for certain facilities, you have
Yes,
to pay
sir.
for it. For instance, uh, in government setups in India, the infrastructure is not that good.
Yes, sir.
So the ICUs, they have a lot of machinery which is imported.
Yes,
For
sir.
example, the ventilator, the Drager company ventilator amounts to somewhere around 20 to 30 lakh rupees. So the cost of a certain ICU is measured in a way that the running cost of the ventilator, for example, the tubings, there's something called filter.
Yes,
There's
sir.
something called sensor. There's something called oxygen sensor. So the running cost per day per hour of the ventilator, it is calculated, and then the cost is given to the patient,
Okay, sir.
and the overall profit to the hospital is around anywhere between 6 to 8%. So
Okay,
if
sir.
you're paying 100 rupees to the hospital will not gain more than 6 rupees per patient.
Okay, sir.
Such is the number.
So here are many things. Can you please tell me that sting is good for health or not?
Oh, of course not. Sting basically has got caffeine, and the content of caffeine in Sting is 80%, which is a very high dose. So, what caffeine can do is it can cause tachycardia. That means your heart rate can go beyond the normal limit. It can cause tachyarrhythmias. It can cause nervousness. It can cause insomnia. If you are an athlete, you
Yes,
take
sir.
Sting or Red Bull for that matter, and post running, your heart rate always increases.
Yes, sir.
So after taking the Sting, a normal baseline heart rate is between 60 to 100. So post exercise, it may go up to 140 or 150. Post caffeine, it may go up to 200 or beyond, and that can cause sudden cardiac death also.
Okay,
So it
sir.
is very bad.
Sir, can you please suggest that which biscuit is good for health?
See, I'm actually against all the biscuits. This Parle-G biscuit now, I always tell my patients also. So a patient takes Parle-G,
Yes, sir.
gets sick, comes to the hospital, and the first snack which the patient takes is Parle-G again. So Parle-G has got the sugar content in Parle-G, or for that matters, all the biscuits should not be beyond 12%. In Parle-G,
Yes,
it
sir.
is around 26%. So this is beyond the limit which is set by WHO. So this is predisposing you for diabetes and blood pressure for that matter.
Okay, sir.
Again, Oreo has got around 28% of sugar. Now these multinational companies are they very smart.
Yes, sir.
They'll not write added sugar. The added sugars content will be very less. It will be somewhere between 6 to 8%. But the overall carbohydrate content will be around 20%. So carbohydrate itself is sugar.
Yes, sir.
So this is their smart way of selling things.
Okay. So what steps we should take for MBBS?
You mean to say how to prepare for MBBS?
Yes, sir.
Say for the NEET exam?
Yes, sir.
Yeah. So off late, I don't know the current curriculum, but it is a multiple choice question curriculum. So I always tell all the aspiring students that start preparing MCQs every day, and start with 20 MCQs. And the day you'll reach 800 MCQs per day, that will be the day you'll be able to crack the exam.
Okay, sir. Sir, is Cerelac good or bad for kids?
See, Cerelac, there was information on the internet that Cerelac may had the sugar content again
Yes,
was
sir.
what the Cerelac which was supplied to India. The sugar content was very high. So Cerelac, what is Cerelac? Basically, it is rice, along with some added conservatives,
Yes, sir.
some added sugars. It is probably used as a first food for the children, and in towns where the mother is not having time to prepare the food.
Yes, sir.
So, but I'll always say, I always advise my patients, attenders, that you should always start with the food which is made at home.
Okay, sir. So what is the ideal age of having a baby?
Oh, very interesting question. And because of the side effect of the globalization,
Yes, sir.
the child bearing age has increased in India also.
Yes, sir.
My belief is that the best age to bear a child is between 20 and 29 years. If you go beyond 30 years, especially for the mothers, the chances of genetic syndromes, especially trisomy 21, which is Down syndrome, the chances are almost become 4 to 5 times.
Yes, sir.
And the hormone levels, they also come down. The quality of sperms and the quality of ova, they are disturbed. And of late, a new concept has come. If you are planning to, planning for a baby in a later age, you should always go for ova freezing and sperm freezing. So these concepts are actually available in the big cities.
Okay. So from which age the kid should do toothpaste?
Okay, so the first 18 months, there should not be any toothbrush or toothpaste to be used.
Okay, sir.
Between the age of 18 months and 6 years, low fluoride content paste should be used. And
Okay,
after
sir.
6 years, the normal routine toothpaste can be used.
Okay, sir. Sir, there is a myth that tea and milk are bad for child's health. Is it true?
See, in our household, when we were living at the farm,
Yes,
uh,
sir.
my father always he never allowed us to consume tea and coffee, and he gave few reasons for that. And when I went through my MBBS and graduation, I understood tea has got caffeine and theophylline and theine. So
Okay,
caffeine
sir.
content of tea is around 11 milligrams per cup, and that can cause insomnia, nervousness, that can cause your heart rate to increase, like the way I told, sting also affects
Yes,
that.
sir.
So to my belief, no tea, no coffee till 18 years of age.
Okay. So being a doctor, how do you handle your stress?
Oh, that's a good question. Actually, nobody asks us how do you deal with your stress. See, I start my typical day starts at around 7:30. I get up. Uh,
Yes.
I I manifest for the first 5 6 minutes and I meditate. I believe manifestation is very important, and meditation. Talk to yourself. What do you want?
Yes, sir.
What you are having your short-term goals and what are your long-term goals?
Okay, sir.
I do exercise every day. I believe in balanced diet, and I believe that sugars, they always increase your anxiety. So I take less sugars and I keep calories in tap.
Okay, sir. So how bad is cholesterol for health?
To be honest, cholesterol is not that bad. See, beyond 350, the cholesterol may be bad for your heart and coronary artery disease. But somewhere between 220 to 270, 280, the cholesterol actually is good. Cholesterol actually is needed for the body to have a normal functioning, normal metabolism.
Okay,
Cholesterol is a
sir.
part of cell membrane. It is a part of a lot of hormones. And if your cholesterol is somewhere between 250 to 60, you have only 1% of getting cancer. So this is a new thing which I'm telling you.
Okay, sir.
As cholesterol between 250 to 270, you'll never have cancer.
Okay, sir. So there is a myth that child starts learning easy with the walker. Is it true?
Walker, of course. So in our times when we were kids, we had that gadirna, the tripod thing.
Yes,
So
sir.
that's called first step walker. So first step walker can ease, can help your child to start walking early. But the walkers, these recent new age walkers, where the child is in the between and it's like a circle,
Yes, sir.
actually that causes delay in walking. It actually creates a sense of fear in the child's mind that the child will, after without the walker, the child will
Yes, sir.
fall down. One thing, it causes because the spine is supported, because the child is sitting in the walker, the spine becomes a little weak,
Yes, sir.
and the strength of the legs, it decreases down.
Okay,
So
sir.
that circle wala, I don't know what they call it in English. So that circle wala walker, where the child is sitting in between, it can actually delay the walking. Plus, if the child is staying upstairs on the first
Okay, sir.
floor, It causes the child sometimes can fall down from the stairs also. That's dangerous.
Okay, sir. So we should give salt and sugar to the baby?
Yes, of course. Salt is a normal necessary mineral which you need every day. So the recommended dose of salt is around 2300 milligram per day.
Okay, sir.
Now, there are four types of salts. One is kosher salt, one is the table salt which we use, one is rock mountain salt which is pink in color, and one is sea salt. So almost all the salts have the same sodium content, somewhere between 450 to 560 milligram per quarter spoon. So there's not much of a difference, and it is well below the recommended daily dose. So choosing amongst the salt, I'll say the sea salt, it has got the danger of having lead inside it. It can be dangerous. The rock
Yes, sir.
salt, the color, the pink color actually is because of certain minerals like sodium and potassium. So again, there'll be some, some adulteration in the rock salt,
Yes, sir.
and the kosher salt is the best salt to cook food, and there's no added advantage of using sendha namak in your daily food items. So now your question comes to whether your child should be introduced salt and when should it be introduced. So actually, the baby has got those taste receptors from birth only.
Yes, sir.
So at 6 months, we usually say you should introduce salt, and you should also introduce sugar also, the extra sugar. If you are asking about what is sugar, if you are talking about this normal sugar grains which we're using to sweeten the taste of your food, that should not be given. Otherwise, natural carbohydrates are needed, natural salt is needed for your good metabolism of your body.
Sir, there is a myth that if we put kajal to the child's eye, the eye look bigger.
Yeah, this is a myth. So there's no concept of that kajal can increase the size of the eyes. Yes, whenever you're darkening the sides of your eyes, so it will become black, and
Yes,
from a
sir.
distance it may appear, एक कहते हैं ना छलावा होगा, दूर
Yes,
से
sir.
दिखेगा कि भाई है तो आंख छोटी, पर वो काला कर दिया चारों तरफ से तो वो बड़ी दिखेगी. इसका नुकसान क्या है? फायदा तो कोई है ही नहीं. नुकसान क्या है? नुकसान ये है कि द काजल कैन कंटेन lead, can cause lead toxicity, and maybe the child may suffer from anemia, may suffer from chronic lead toxicity,
Okay,
which
sir.
may decrease the hemoglobin permanently also.
Thank you, sir. It was a great meeting to you as I got to know about many new things. So we'll meet in our next podcast. Thank you, everyone.
Thank you so much.
Sir, what mistakes new parents are doing in parenting of their kids?
See, there's a difference. There may be a difference between my thinking and others' thinking. According to me, the new age parents, what they're doing is they're not putting pressure, any pressure on their children. So they're not giving targets. So if a child, for example, is not performing well in sports or academics in the school, now the new age parenting is do not ask questions,
Yes, sir.
just encourage. So if you're not giving targets to your children and you are not scolding them, actually the competitiveness in the children will go down only now.
Yes, sir.
So according to me, I may be wrong, but according to me, you have to give certain targets, and the children, their activities have to be tabbed from time to time, and they should be under a screen. Second uh, problem which we are actually experiencing from the parents is then whenever a child is scolded by a teacher in the school, the parents, they would come to the school and they'll actually question the administration. So I think that's also again bad. A teacher always wants their child to perform well in academics, in sports, whatever. And if you are asking the teacher not to scold them, they'll never be on the right track. This is
Okay,
a
sir.
second mistake. Third mistake is exposing your child to a lot of processed food.
Okay,
Fourth
sir.
mistake, because the parents, they are not having enough time, they expose their children to screen time.
Yes, sir.
They are exposed to the laptops, the computers, the YouTubes, and whatnot channels, and a lot of stuff is available on the internet. Because the parents, they are not having time for their children, they'll
Yes,
allow
sir.
their children to be on the internet
Yes,
and
sir.
on the screen time. That actually is hampering the overall growth and overall development of the child.
Okay, sir. So most of the children are using mobile phone. Is it good for the eyes or not?
See, according to my belief, children should have minimal screen time, and if unavoidable circumstances, it should not be beyond 1 hour. And because obviously there are lights emitted from the screen, and which may impact the eyesight also of the children.
Okay, sir. In this video, we'll learn about the myths, facts, and effects about the new parenting tips.